Fear and anxiety about the ongoing COVID-19 pandemic is often overwhelming and can cause strong emotions for people. This often results in stress that occur as a result of uncertainties about one's own health and the health of loved ones. This can often cause depression and anxiety among patients and frontline workers. And I will be talking to maternal and child health and wellness consultant Julie Mobo, who will be telling us how best stress can be managed, especially at times like this. Julie, good morning. Good to see you.
Good to see you.
And nice to have you live in the studio this time around.
Yes, it's such a pleasure.
We've always had you virtually, and
yes,
when I heard you were in Lagos and you were coming in, wow, it was nice to see you, really.
Honestly, it's a pleasure to be here.
Now, let's start it this way. I know you have been on the front lines working. We've spoken in the last, through 2020 and, parts of this year, we've been talking to you and you've been sharing some of your experience with us regarding management of COVID-19 and things like that. Now, when it comes to the stress, give us a picture when someone like you, who is a consultant and who has been in the front line helping people with COVID-19, how stressful is your everyday when you have to wake up knowing that there are people out there who need help, and yourself, you need help for yourself and even for your family, but you have to be there for other people. Tell us that balance.
Okay, so it's actually not an easy one because the people who need help, all they know is that they want to get help. So it's kind of difficult getting them to understand that the people you're asking to help you are also in that same environment that you're in. But what we tell ourselves oftentimes is that the one who is sick comes to us at their most vulnerable stage. So they just expect us to do our jobs. And so we have to find ways to cope with whatever it is we're all going through so that we are in best shape to render help to those that need them.
Even when deep down you're facing your own challenges and trying to be careful.
Enormous, I must say, because like for instance, there are a group of nurses I'm currently working with. We had to get into a program with these nurses so that they can, with the work they're doing with the patient's level of satisfaction can improve. I discovered that up to 90% of these nurses actually commute more than 21 kilometers to work.
Wow.
More than 21 kilometers, 90%. So they have to report early. If you don't come to work early, the person who has to hand over to you perhaps is yet to pick her child from school. There's no proper arrangement. I have seen healthcare workers whose children are ill. They aren't feeling well, but they have to report to work. I've come in contact with some of us and we say, you're not feeling okay. There's no way. You can't even appear like this in front of your patient. Just take a sick leave and go take care of yourself. So it's kind of difficult because we have to be in good shape in order to take care of the people. But when the patients come in, all they want is, I need help, I need attention. So you need to be humane enough to attend to me. You need to listen to me. You need to come to me when I call. We've had patients and patients.
So at the back end, you, other nurses, other health workers who are at the back end, how do you engage each other when you know that my colleague, my friend, whom we are professionals together, is going through some of these challenges? How do you stand in for each other? How do you help each other? How do you assist each other to stand and face all of this frontally?
Yes, it's been amazing to some extent, the level of support that we render to ourselves. So you find a situation whereby someone is facing a particular crisis and is supposed to be on duty or on call. So you put a call through to your colleague and say, I'm unable to. Okay, so don't worry, I'm going to cover for you. So you have people covering shifts, covering calls for their colleagues so that they can go mind their businesses. That's one of the ways. Then other ways, the challenge with care workers is that they really do not have that time to go for recreational activities.
And refresh and then
and
come
refresh
back.
and rejuvenate and then come back. So you ask them, when last did you go to the movies? They said, do we know what that means? They have no idea.
I can only
so
imagine.
it's actually a challenge for them. And I'm thankful to some hospital management. They're beginning to bring in programs. They're setting up wellness departments to see how within the facility something can be done for the healthcare workers so that they can be in top shape in order to render quality services to the people.
Now, from your engagement with people, are people getting, anyway, well, it is normal to assume that people are becoming more aware, but we still have this hesitancy towards the vaccines, even towards regular primary protocols of hand washing and distancing and all of that. People will say, oh, well, we've heard this over and over again. But how aware really are people when it comes to taking action to live by those protocols and live by those advice and then being ready to take the vaccines and moving on with safety?
I don't know if to say it might shock you to learn that there are still some people asking if COVID-19 is real.
Wow.
Yes.
In 2021.
There are still some people asking, is this really real? And then there are those people that say, this is real. Take necessary precautions and all that. So we've found people that are beginning to realize that, okay, so this is real. Apart from that, this is a normal, healthy routine that I just must do and engage my family as well so that we don't get sick. Because one of the things we're telling people is that our healthcare system is already in a comatose state. You don't even want to end there. There's a lot going on. The healthcare workers, they are stressed. And the queues are getting longer. So there's limited time for a doctor to consult with a patient. So you can't spend so much time. So we tell the people, just find a way not to get into this place because you're not even sure that you will get the maximum care that you need in order to go through this and come out strongly. So we also have, in a school environment, we have seen some school management, they discovered that lockdown has had a negative impact on the children. So they're bringing in professionals to talk to the children to see how they can get them back into a healthier learning state so that work can go on. So on all fronts, people are doing what they can with information available to them. The challenge on our part or responsibility is to keep putting this information out there to increase the awareness of the people.
Now, do we still have some level of fear and anxiety? We remember in the early days of COVID-19, people were so scared, people were so anxious of what is going to happen, that uncertainty, that scare. Do we still have elements of those in the minds of people these days?
We do. We have that. So there's the fear of not having a full understanding of what COVID-19 is. There's the fear of falling ill and ending up in a hospital and contracting an illness you didn't go there with. There's the fear of the uncertainty. What's the outcome? How long is this going to be for? Are we ever going to come out of this? Are we ever going to return to our normal lives as it used to be? So that anxiety is there, that fear is there. And for those who have encountered some setbacks as a result of the pandemic, they without much motivation to come out of it, they start slipping into depression. And sadly, we don't have that much programs that help people. Sometimes it's difficult for someone to come out and say, I have been going through things. I need help. But thankfully, a number of people are beginning to come out to share their down moments, giving others the permission to do the same thing, telling them it's okay to talk to people, it's okay to talk about it. Yes, inspiring people. So thankfully, social media is helping in that regard. I recently came across some information. Someone that I know came up to say, you've not seen me on social media for a very long time. This is what I've been going through. So it's not that easy. It's a lot of work still ongoing. On the part of the people, we're telling them, don't go through these alone. I know that the fear is there. Don't go through this alone. Talk to somebody about it. And then for the healthcare workers, we try to get them to understand what the people are going through. Because some of them cannot just get their heads around the fact that this person needs care and is hesitant about it. Why wouldn't you just take your medication?
It's a complex balance.
It's a complex balance.
You need help, there's help, and you don't want to get it.
Why are you not taking it? Why are you not accepting help? What is that? So sometimes health workers they're confused. They're like, what is wrong with these people? This is what you need. So what we're trying to do is let them understand the peculiarities of this. It's not an easy decision for them to take. People have different personalities, and these personalities show up in the decisions that they take when it comes to do with their health. It's not that they want to be healthy. For instance, there was a particular man who gave a conditional consent for his wife's surgery. Wow. Conditional. He said, I will only make payment if you assure me that this will be successful. So the healthcare worker was like...
That's a very difficult position to be as a health worker.
So the health worker couldn't understand. The patient, on the other hand, as well, could not understand why this could be conditional. Just make the payment. We cannot say if I'm going to come through this or not, but that's a difficult situation.
It's really difficult. I can imagine.
We have to understand where the man is coming from. He just needs to be sure that everything will be okay.
But there can't be any guarantee. We're just doing the best we can. But the point there is, as we wrap up generally, the issue of awareness and communication to the people to create that enlightenment is still there. What more can we do when it comes to enlightening people and getting them to take the vaccine? We have the vaccines now.
We do have them. I think at all levels, whether it's establishments, schools, workplaces and all that, we just have to keep doing this. Then create counseling sessions, therapy, where people can just walk in, talk to this person. Do you have concerns? Do you have fears? Are you anxious about certain things? They should have all these occupational therapies, whatever they call them. Get your staff to talk to these people. Is there anything you're bothered about? Talk to them and let's see how we can help the situation. So apart from creating awareness on media and all that, I think there should be some counselors in different establishments and staff, people encouraged to talk to them.
Amazing. Julie Mobo, I just wish we had a lot of time to talk more, because there's so much things we need to talk about here. But I thank you so much for coming, and thank you for what you do. We really appreciate what you do out there, helping people with those who need help, especially at times like this with the COVID-19. Thank you very much for what you do.
It's a pleasure. And thank you also for always having me.
We have to do our part in our little way. Thank you so much.
Yeah.
Right.